sleep quality drives almost everything that's going in individuals who are struggling with their sleep. And what's problematic about that statement is how difficult that is for a person to recognize that idea as being relevant to them.
Welcome to the Lara Jane Layton Show. This podcast is for you, the person who keeps putting others first. Your self-talk has held you back. You no longer need to take a second seat. Let's explore ways to overcome self-doubt. You can silence that inner bully voice and achieve your full potential. Here's your host, Lara Jane.
Welcome to the show, friend. I have a new best friend with me today. His name's Barry. And I've been thinking about sometimes I'm really restless going to sleep. And sometimes I wake up in the middle of the night and I'm awake all night. And then other times I wake up early and I hit the ground running. And did you know that sleep is really critical to everything about our lives, our physical health, our mental health? And, sometimes we're popping all these pills and taking medication and I got to get a good night's sleep tonight. I'll just take a sleeping pill. And then you wake up groggy anyway because of all those overdoses. And what can we do to improve our sleep? I'm kind of looking at sleep is the foundation. Did you know that sleeping's not being lazy? Your body is working away and doing amazing things. And Barry's going to tell us all about this and help us get a better night's sleep so we can live our best life. So Barry, help my friend and I live our best life through getting a little bit more sleep.
Well, thanks so much, Laura Jane, for having me on your show. I think the question that comes even before the one that says, what's going on with these pills that we take for sleep is, why did we end up in that pathway? How did we end up being someone relying at least occasionally or regularly on sleeping medication? And that immediately suggests, from my clinical background as a sleep medicine physician, that there is a misunderstanding about what sleep is. In other words, if you end up on pills, it often means that you've not really been well educated by your doctors who are prescribing the pills, or maybe you have not received a lot of information or input in various things you've read or podcasts you listen to about sleep. Because sleep is, if nothing else, it's natural. We all sleep. So pills are a last resort solution that are relevant for some people. I'm not trying to dismiss that. But in general, the pathway through which somebody went down and got on pills usually means there was a huge knowledge gap where that individual was not given so much input that they could have chosen a different pathway, a different decision, a different option. So that's how we look at that just when we have somebody who walks in the door at a sleep center. It's like we want to know, well, what do you know about sleep? I mean, how did you come to a sleep center? What did you try before? And of course, people have tried so many different things before they ever make their way to a sleep center.
I think not everybody's been to a sleep center because there's ways that we can do it from over the counter or, it's like, I just need sleep. I just have a headache. I can't go to sleep. I'm just going to medicate. And I never get out the door to a sleep center. When would what would be going on in my life where I should have, or I chose to go see a sleep center to help me live my best life? What would be those things? That just not sleeping well at night?
So that's the start of a person wanting to go through the self-discovery process and learn about these knowledge gaps about, well, what is sleep? And of course, the biggest myth about sleep that I believe you're alluding to here is that we're so focused on the number of hours of sleep. But the number of hours of sleep often isn't the solution to most people's problems. They might think it is. I don't want to knock the people who go, gosh, I have this very horrible schedule and I just need more sleep. I accept that that can be true. And for some people, then that means they have to make adjustments in their lifestyle. But the overwhelming majority of people who have sleep problems, where they've done a bit of self-discovery and they've recognized, gosh, I don't really feel that rested when I wake up. And I wish I could sleep more. And I'm tired during the day. And sometimes I could even take a nap. That's just the beginning. That's just the tip of the iceberg of an individual who is raising this level of consciousness in their mind about, well, maybe I don't understand what sleep is. And that leads to the hallmark approach to sleep that we began working on over 30 years ago in the 1990s, first at a university sleep center, then at my own private sleep research center and my own sleep medical center. That was in Albuquerque, New Mexico, same time zone as you. Now I'm in Savannah, Georgia on the East Coast. And we looked at sleep quality. And we recognized fairly quickly that sleep quality drives almost everything that's going on in individuals who are struggling with their sleep. And what's problematic about that statement is how difficult that is for a person to recognize that idea as being relevant to them. I'll give you a couple of examples if you'd like me to start off and explain that.
That'd be great. Yes.
So, for example, if you wake up in the morning with a headache, your first response is, okay, I have a headache. Oh, well, maybe I need to drink some caffeine. That would be the most common response. Another response would be, I don't know why I have a headache, but I'm going to get up and I'm going to walk around. Maybe it'll go away. I don't know. But it turns out there's a connection between sleep and headaches. So that's one example. Another example is I wake up in the middle of the night to use the bathroom to urinate. And I notice that when I do that, I get kind of wide awake. Then I get back into bed. Then I can't fall asleep. So that person does some reading on the internet or reads some books or whatever. And they go, I wonder if I'm drinking too much fluid at night. And they go, well, I'm going to restrict my fluid. If I restrict my fluid, I'll decrease my trips to the bathroom. Well, restricting your fluid at night actually is going to lead to dehydration, which isn't a good thing, could lead to other symptoms, could lead to less trips to the bathroom. But it turns out there's a very specific connection between sleep and trips to the bathroom that 95% of people don't know about. In fact, 90% of doctors don't know about it. So I just described two things that are very deeply physiological problems. One is a headache. You have a headache in your brain when you wake up from sleep, or you wake up in the middle of the night and you have to use the bathroom to pee. The person who hears those things doesn't say, oh, I wonder if I should ask my doctor about this. They don't. And if they did ask their doctor would not say, oh, you need to go to a sleep center. But I'm here to tell you that if somebody told me they woke up with a headache or they had trips to the bathroom at night, I'd say, gee, it sounds like you need to go to a sleep center and get a sleep evaluation to find out if there's something more seriously going on with your sleep quality.
You talk about this, and I'm thinking back when I definitely had sleep problems and was brought it up to my doctor. I wake up every morning with just a pounding headache and just, these things. And he says, well, it wasn't drink water, do this. And I go, I want a sleep study. Can I qualify to get a sleep study? And so I had to ask to go and have this done. And of course, I have my little fun CPAP that helps me sleep, and I don't wake up with headaches, and I will wake up a lot less frequent at night. But not everybody has that. And there's other things that lead to these sleep disorders. But yes, ask your doctor, get the referrals if you have some of these symptoms. How do we know or what symptoms to look for? Should we Google it? Um, what should we do? Because, I mean, you've talked
Well,
about these not having to pee at night, and that sounds wonderful to me. How do I find this information?
right. Well, one thing you can do, I'm happy to promote my newer book, Life Saving Sleep: New Horizons in Mental Health Treatment, where we delve into the fact that so many people think about sleep as psychological, as something to do with the brain, without necessarily realizing the physical part of your brain is being directly affected by sleep. Your whole brain is physical. So, how could it not be physiologically affected by sleep? Is another way to say that. So, when a person is going about this process, they're going to start usually by wanting something that's a simple solution that doesn't require investigation. And that's a big mistake because what we need people to hear is that when you don't sleep well, this physical thing I'm talking about, sleep in the brain, you're actually causing brain damage. So, bad sleep quality is the same as brain damage. And so, when you talk about, well, there's a lot of different factors, there are, but the single most common factor, the one that is overlooked over and over again by doctors, psychiatrists, psychologists, primary care doctors, health coaches, whomever, is that the sleep disruption that's occurring during the night, we call it sleep fragmentation, where the brain is going back and forth between being asleep and being awake, and you never even know it. The number one cause of that is breathing. And so most people spin their wheels looking for some other solution because they don't like to hear the fact that the chances of them having a sleep breathing problem means exclusively, oh, you mean I got to get a CPAP machine? So, okay, well, I'm done. I'm not interested in that. So we'll be able to talk about that because there's ways to get to a CPAP machine. And by the way, I'm not a strong advocate of CPAP. CPAP is actually, in my clinical experience for almost 20 years now, an obsolete type of treatment for sleep apnea. There are much better devices out there, far more advanced than CPAP. And so I would tell anybody who's using CPAP to look at the response they're getting and ask the question, well, have you ever wondered whether your response could be better? Because if it is, then there's other PAP machines that are far superior to CPAP. So that what I just put out there is a lot to digest, but it's something that people have to ask themselves, do they want to step back and say, wait, this is a really big deal? Dr. Krakow is telling us that if I don't sleep well, I'm actually suffering brain damage. And let me clarify what that means very specifically. 10 years ago, they discovered there is a brain washing, it's not a joke, a brain washing system inside of your brain, and it cleans out toxic waste. And when does it clean it out best? When you're sleeping. And when does it clean it out the very best? When you're in deep, consolidated sleep. That means if you have a sleep problem, I'm just talking about numbers of hours now. I'm talking about you have a sleep problem. That means you're not going into deep, consolidated sleep. That means your brainwashing system is not working. That means you have increasing brain damage that actually creates a risk for dementia, memory problems, concentration problems, attention problems, all because there's something seriously, fundamentally wrong with your sleep quality. You'd like to think that gets a person's attention. And they go, oh, well, then this is a lot more involved than I thought. And maybe I don't want a quick fix. Maybe what I want is more information from the right doctors who know what's going on here so I can do something about it.
And or what is that information? Like, we have your book and we can all run out and grab it. But sleep is so important. And even with medication puts me in the wrong sleep cycle. I don't feel like I get good sleep when I've been medicated. Um,
You
but
know why?
no, tell me why.
Well, because your sleep medication is not treating your quote unquote sleep disorder. Medications are designed primarily. There's exceptions, and by the way, there's some people who get great responses to sleeping pills, and they're very fortunate and very blessed that those pills can work that well for them. But the majority of people do not get that effect. Most people, whether they recognize it or not, they're using these pills for the problem that's called sleep continuity. They want to know that they can get into bed and reliably go to sleep in a certain time frame. They want to know that they can reliably not wake up much during the night. They want to know that reliably, if they do wake up, they're going to still be sleepy and fall back asleep. And then finally, they want to know that they can reliably get through a certain number of hours so that in the morning, they've made it through the sleep cycle. Now, the reason that is so attractive and so compelling is that the respite, the psychological respite that any human being obtains just by going so many hours of not being conscious of this crazy world we live in is extremely beneficial. So this is why so many people can like sleeping pills and yet get confused about what they're doing. You'd want the pill to deepen your sleep. You'd want the pill to consolidate it in a certain way where you know that your brainwashing system is going to work, where you no longer have trips to the bathroom, where you wake up and don't have a headache in the morning. And of course, most of all, you wake up and you feel great and you have energy all day long and you rarely even need caffeine during the day. That's what you want. But what most pills are doing is not that. It's giving you continuity, but that continuity is very seductive because if you can sleep through the night, you can wake up and feel like crap, if you pardon the expression, but you're still thankful that you got through the night. If you think about when do people become the most suicidal and have the most self-harm thoughts in their life, in their lifespan, in their life cycle, it's during the night. Why? Because they're not sleeping and they're alone, they're by themselves, and they are thinking really bad thoughts. Well, if they were sleeping, they couldn't have those thoughts. They could have nightmares, they could have bad dreams and so forth. But in general, self-harm thoughts are much more accentuated by putting yourself in an isolated period, a lonely period where you feel very vulnerable and you're not doing what? You're not doing the thing that supposedly everybody else does. You get into bed and go to sleep all through the night, you wake up and now you get started again. So that continuity thing is very seductive, but unfortunately, it doesn't tell you anything about the quality of sleep. That's the reason most people are on a sleeping pill. Then they make the mistake of because they're getting the continuity, they're kind of indirectly looking at the quality and going, well, I think the quality is okay, or it's not so great today. Maybe I'll have another cup of coffee. Oh, but at least I got to sleep through the night. And with that kind of focus, those individuals don't change their behavior for years. Many people on sleeping pills wait until the complete deterioration of the effect is gone. They no longer sleep through the night and they're aware how poorly they feel. And they're going, well, what is this sleeping pill doing for me? That's when they go to a sleep center or that's when they go to a psychiatrist and say, well, doc, this isn't working. What should we do next? And that doctor then hopefully would say, gosh, it sounds like we should send you for an evaluation at a sleep center.
So I think what I'm hearing is when we're using sleeping pills, we may sleep all night, but we may not be getting the correct type of sleep to feel rejuvenated in the morning. And that there are ways around this medication cycle to sleep better. So let's take a break, get a word from our sponsor, and let's come back. And it's like, how can we get better sleep and get rid of the medication? So we'll be right back. Hey, since I rarely have openings in my coaching schedule, I have a new resource out there on my website. It is called the BFF Coaching Network. And I have offered a spot there for any coach that has been on the show to list their coaching. You can go out there, you can listen to their episodes, you can feel a little bit about them, and then choose a coach that will work for you. So LauraJaneLayton.com, the BFF Coaching Network. All right, Barry, help us to never have to take a sleeping pill again. How can I get to sleep and get the right kind of sleep?
So in this book, Life-Saving Sleep, and another book that I wrote called Sound Sleep, Sound Mind, are the answers to those questions. The good news is all the information you need is in the books. The bad news is, I'm being very honest now, for people who are on medications and regularly use them, it can take months or a year or longer to stop using medication to sleep, because you have to have the right information, you have to have the right resources, and especially you need to have the right support from sleep doctors, sleep coaches. I run my own sleep coaching service as well and help people in these situations because they're very complex. So if I run through this for you, it looks something like this, because we'll come back to something very, very straightforward and seemingly simplistic that people can try tonight to actually begin this process. The first thing is all about self-discovery. You have to be able to ask yourself the hard questions about, what is your sleep quality? Is it good? Is it bad? Is it ugly? What is it? And you've got to make a decision that you're going to be honest with yourself. And there's so many ways to do it. I've got a lot of this stuff in the book, but it's really, really easy. I mean, you're supposed to have good energy during the day. That's the nature of sleep. If you don't have good energy during the day, you can presume there's something wrong with your sleep. If you wake up at night during the night to use the bathroom, probably a sleep disorder. Wake up with a morning headache or a dry mouth, probably a sleep disorder. If you snore, probably a sleep disorder. If you can't control your blood pressure, often a sleep disorder. If you suffer from ADHD type symptoms, memory, concentration, and so forth, again, possibly a sleep disorder. If you do that self-discovery and you go, you know what, I think this is me, then your next question becomes, how did this happen? What's going on with me? The answer in 90% of the cases or more is some type of sleep breathing condition. Now, this is the two pathways ahead. One is very long. It's go to the sleep center, get evaluated, consider the possibility of CPAP, consider the possibility of surgery. All of those things are worthwhile, but they take a while to go through. In the meantime, if somebody's using medication, they're not going to stop the medication. That's what they've grown to be to have a reliance on, and they're going to stick with that. And this is where I adopted in my book what we call conservative early treatment of sleep disordered breathing. And this is where people can get a tremendous mileage, where literally tonight, and certainly this week, they can use this information and start sleeping better. That's how remarkable this is. And it all has to do with one thing, your nose. So everything about your nose has everything to do with this problem of sleep disordered breathing.
All right. So how do I fix my nose or not?
You begin by the self-assessment that most people who are dealing with these kinds of problems have a nasal symptom of some sort. The three most common nasal symptoms are nasal congestion, are nasal stuffiness, and another one is a runny nose. There is a fourth one. It's a little bit different. It's anatomical. It's where they actually have a recognition of the deviated septum and that one side, the airflow seems different than the other. Those are four different things. All four of those things are extraordinarily common in people who have sleep breathing problems. And that means that if you start to aggressively treat your nose with a variety of techniques and methods I'm going to describe here in a moment, you can go to sleep tonight and wake up the next day and go, that was different. I slept differently just by doing this one thing. So in the book, Life Saving Sleep, where we talk about the conservative sleep disorder breathing treatment steps, we start with something as simple as nasal saline sprays. And we've had people who had no interest in CPAP. CPAP was the farthest thing from their mind. But we'd say, well, we're not going to prescribe CPAP if you don't want CPAP, but can we get started on something simpler? And they go, of course. Well, what do you have in mind? And the answer would be spray nasal saline in your nose several times a day, 3 times a day, 5 times a day, whatever you want, and clean out your nose. Now, here's where the rubber meets the road, so to speak, because most people normalize their nasal breathing. A person says, well, I don't think there's anything wrong with my nose. I say, well, that's very interesting, but you can try this experiment. You can start squeezing nasal saline rinses in your nose several times a day, cleaning it out, going into a steam shower at night or in the morning, cleaning out your nose. So many people do this, and they come back a week later and they go, this is crazy, but I thought I was breathing through my nose perfectly normally, and I realized I wasn't even close to normal. I got all kinds of junk out of my nose. I realized I had been mouth breathing. So that process is the earliest possible step. And we've seen people come back 2 weeks later after doing nasal saline sprays only, nothing else. 2 weeks, they come back and go, I know you told me to clean up my nose, but was I supposed to be sleeping better too? I go, well, as a matter of fact, yes, you can sleep better just with that. And they go, well, that's really peculiar because in 2 weeks of cleaning my nose, I'm sleeping better. I said, all right, well, now let's go on to the next phase. Would you like to use nasal strips on your nose? Would you like to try some of the specialty sprays that are for these problems of stuffiness and runny nose and congestion? Nasal steroids, antihistamine nasal sprays, anticholinergic nasal sprays, xylitol nasal sprays. All these things are on the market. They're relatively inexpensive. Many of them are over the counter. Most of the people we've ever treated for these kinds of problems are on at least one of those sprays. And that medication is further improving their nasal airflow. Nasal strips work. Nasal dilators are little plugs that go up into your nose and actually expand the valve so that you get more air in. So if we just stop with that, we say nasal saline, nasal sprays, nasal strips, and nasal dilators. Anybody who vigorously takes on that, what we call nasal hygiene program. And by the way, on my website, barrykrakowmd.com, there's a free video series on this called The Nose, N-O-S-E, Nose, K-N-O-W-S. The Nose Knows. And so you can get that same information on the website for free. You can also get it in my book, Life Saving Sleep. And when a person goes through these steps, what usually happens is you have the buy-in. And what do I mean by that? Nearly anybody who's got a problem with sleep disordered breathing will discover within a couple of weeks they're sleeping better. And they'll go, this is crazy. I mean, if I can do this simple stuff and already start sleeping better, well, how much else is out there technologically to make me sleep more better? And that's when people start actually asking the question, well, should I consider CPAP? Should I consider one of those dental devices? By the way, I forgot to mention that some people are also having good luck with mouth taping techniques. But I like to encourage nasal breathing treatments first, then applying mouth taping after you know the nose is working better. And so the last point I want to make is if a person does go forward with this and they say, I am interested in PAP therapy, I want them to know that there are so many better devices out there now than CPAP. And unfortunately, most sleep centers push CPAP on their patients. We stopped prescribing CPAP in 2005, 20 years ago. We only prescribe bilevel. These are very advanced PAP machines. They deliver the pressure much more gently. They produce far less, if any, anxiety, whereas CPAP triggers anxiety in many, many patients. So if you can get one of these more advanced PAP machines, it's a much better way to start than starting with CPAP. Unfortunately, we're living in a day and age where the sleep centers are very much governed by consensus medicine, government regulators, insurance companies, and they all say, oh, just use CPAP. CPAP will be just fine, blah, blah, blah. And it's remarkable how many people fail CPAP. So that's how we learned this 20 years ago, and we stopped using CPAP.
For me, I think we use the word CPAP because people know what that means. Like if I told you I was on an APAP, you would know, but the people that I hang out with wouldn't know the difference, right? Or if they do,
Right.
that
So,
didn't matter.
right. So APAP, well, no, it's a very important point because APAP stands for auto CPAP. And unfortunately, auto CPAP has many of the same problems as CPAP because it's only one pressure every single time it adjusts. Auto means it has an adjusting capability, which is great. But the change is not for anything other than sensing general collapsibility in your throat, not specific to each breath. I'll give you the quick distinction. If you breathe in and you breathe out with CPAP, auto CPAP, whatever you call it, it's one pressure. So if the pressure is 12 in, it's 12 out. Same thing, doesn't change. But it could change later. You could roll onto your back and the auto adjusting says, oh, let's raise the pressure. Now it's 14, but it's still 14 in and 14 out. Bilevel is much more advanced. It changes the pressure based on when you breathe in and immediately when you breathe out. And that's the huge difference because physiologically, you don't need as much pressure to breathe out as you need to breathe in. That's why bilevel devices are far superior and why so many people find them more comfortable, less anxiety producing. And we've spent an enormous part of our clinical and research years working with PTSD patients, and they can't handle CPAP. CPAP makes them feel claustrophobic, like they're drowning in air. And so we put them on bilevel devices, and immediately they felt the difference. And that should be the standard of care.
And I'm sure they're going to get there. But like you said, insurance companies kind of control a lot of what they're willing to pay. And so you kind of get stuck on that. But that's not the point of our conversation. So as we get the right device or the device that works for us, or we're able to get better sleep with the nose, what did you call it? Hygiene,
Nasal,
cleansing?
yeah, nasal hygiene. Nasal
Hygiene.
hygiene, right.
So with that nasal hygiene, as we start, and I know my husband uses that one that flushes it with a saline solution,
The Navage or the neti pot?
the Navage. And so
Right,
that's
right.
what he does
Very,
before bed, but
yeah,
he
very
should be
good
doing it
things.
3 times?
No, not
Oh,
necessarily. In other words, Navage and neti pot are much more aggressive. And they're both valuable tools, and especially for people. And this is where you get into this whole discussion. It's very important for people to hear. Most people don't understand that nasal breathing does have a normal, perfect, zero tolerance place you can get to. And yet, so many people, unfortunately, suffer from what's called chronic rhinosinusitis, where they have all of these difficulties with nasal breathing and they're not getting the support they need from their doctors. That's why things like neti pots and Navage are very popular. And thank goodness for American free market capitalism that brings people into these inventions, because now you've got an option. You just can go out and buy it and use it. And that's absolutely making a tremendous difference for so many people, because now they're realizing there's all this junk collecting up in their sinuses, up in their nose. They use these devices that are even more aggressive, as I said, and they're getting a tremendous response. Not everybody needs them, but the point is, whatever those aspects are that help you get to normal nasal breathing, it is worth its weight in gold to be able to get to that place. And that alone almost always leads to better sleep just by doing those pathways.
And you mentioned another thing was mouth taping. And I actually attempted this for probably 6 weeks. But I do have to say, after 2 weeks, I did quit getting up in the middle of the night to go to the bathroom. Whatever that additional stuff, and I've not taped for a long time. So I now get up in the middle of the night again to go to the bathroom. But that is one thing that I definitely attempted, and it did help. I just didn't keep doing it because it's not all that fun.
Right. Well, switching from your auto CPAP to a bilevel could easily solve that problem. With most people, again, I have another free video on my website, barrykrakowmd.com, that is about nocturia. And nocturia means, trips to the bathroom at night. And there it explains, a very short video, that when you have sleep breathing difficulties, it actually causes a diuretic that's natural to your body to be released into the bloodstream, cause you to make more fluid to pass through the kidneys, and therefore make more urine. So most people who get treatment for sleep disordered breathing that is at a high level will often declare no more trips to the bathroom. Whereas somebody who's getting a fair to partial treatment of sleep apnea often will say, "Oh, well, I'm still waking up at night to pee at least once." They may have been peeing 5 times or 4 times or 3 times. Now that they're down to 1 time, they're going, "Oh gosh, this is great. Like, it's only 1 time." But that 1 time is a big deal if you're an insomniac, because now you wake up and you got to deal with that. So we always aim to get people down to 0 trips to the bathroom. And we found a lot of success for that using these auto adjusting bilevel devices, which we found to be superior. And we published many research papers on this topic in the field of sleep medicine, psychiatry, respiratory medicine, and so on.
And I'm thinking back to when I was being presented with options for sleep. And I do know that my doctor said something about not qualifying or not having enough sleep events to get insurance to pay for the BiPAP. So is that something that, this has been years. So it's very possible this is no longer something that's even an issue.
Unfortunately, it probably is still an issue. It's a very complex issue, and it would get too much into the weeds. I describe it in detail in the book. Bottom line is, most sleep doctors think that CPAP works for everybody. They're sadly mistaken. CPAP does not work for the majority of people. It fails them in many different ways, and many people would benefit from bilevel. The concept of qualifying for bilevel, again, very much into the weeds, is a reflection on the field of sleep medicine itself not being aggressive enough in wanting patients to have the option of trying bilevel. If they were more aggressive and more assertive, they could get more of their patients on bilevel, but they spend too much time listening to the insurance people and the government regulators, and they don't think they have some other option. They don't, for example, appeal. A doctor can always appeal a decision. And we did that in the beginning to get our patients to be able to get on bilevel, and it worked regularly.
So, if we were to summarize that, I think everybody can benefit from better sleep. From the people I know, I don't think any of them say, I am a perfect sleeper. Like I always get this perfect amount of sleep. So, it may be occasional. Maybe I'm having a tough time sleeping tonight, or maybe this is every time I have to travel, I don't sleep well. So, what are those things that trigger the not sleeping well? Or are we somebody who is always not sleeping well? So, if we get good sleep, we are going to have clearer minds. I think you said the brain's now been cleared out and it's fit. Our bodies are going to have a little bit more energy. I know so many times I wake up and it's like, okay, the second cup of coffee, you can start talking to me. So maybe these things would make that so it didn't happen where I'm getting the right kind of sleep. And now I know that I can do some nasal um, hygiene to help better my sleep. And I think that's a great one thing for anybody to try. If you're not getting good sleep, try this. But I also think we should ask our doctors. I'm not a medical doctor, but I know I had to say I want this. And so doctors are thinking about it. So if you aren't sleeping well, speak up. So very
Except for
tell
one except for one caveat. Once you speak up, for all you know, the next thing the doctor does is pull out a prescription pad and said, "Oh, here, take this." And that's not really the pathway that we've been discussing. We want that doctor to be an ally, somebody who understands that we're in it to do a deeper dive, a deeper investigation. And if your doctor is not going to do that, then it's best to go on to a different doctor if they're not willing to consider the possibility. And so many people get confused about this. I'll give you the best tip of all. 50% of the people who have a sleep breathing problem are not overweight. So all these people, regular doctors, sleep doctors, they'll go, "Oh, well, you don't suffer from obesity, so you can't have sleep apnea." Well, obesity doesn't cause sleep apnea. Obesity lodges more fat tissue inside your throat, which does what? It worsens sleep apnea. So there are 50% of the people out there in the population. They're underweight, they're normal weight, they're a little overweight, but they would never meet the criteria of quote unquote obesity, and they have sleep apnea. So that's a major hurdle. If you walk into your doctor's office, you're not overweight, you go, "I have a sleep problem, I want a sleep study." They go, "What are you talking about?" And they'll challenge the patient in really stupid ways because they're so ignorant. And this is very problematic. And this is why people have to read more. And of course, that's a great lead into buying life saving sleep. The point is, the more knowledge you have, because we're now going into a new phase of do it yourself medicine with the internet, with online resources, people are going to begin to realize they have this problem. They're going to go out and they're going to buy a wearable and they're going to go, "Oh, well, I checked this thing on my wrist and it says my oxygen is fluctuating. It's saying my sleep is very light. There must be something wrong with my sleep." Bingo. That's absolutely right. And people should be able to walk into a sleep center and say, "I've done all this stuff so far. I'm going to get a sleep study." You know what this people are going to say at the sleep center? "I'm sorry, go back to your primary care doctor and get a referral." So you walk back to your primary care doctor, and that doctor goes, "Referral for what? I'm not giving you a referral to it. You don't need a sleep study." That's how crazy this stuff is. And it's going to take some time to break through these barriers.
yes. And so be your persistent self that keeps
Right.
going. I know that our friend with this is one of those people that is persistent, but sometimes we're only persistent in the things that we pick. So make your sleep quality at the top of your list and be persistent so that you can live your best life. Because I really honestly can tell you that my life changed as I got different sleeping abilities. Now, could it get even better? Very likely. It's like we can get better. And so if you're tired, I know I got a no had to get a note from my doctor because I was falling asleep at work, and the boss kept wanting to send me home, and it's like he had to write a note. "It is not dangerous for Jane to fall asleep at work." So, it's, if you're tired, if you're not getting the sleep and you're getting sleepy in the day, that's a good sign, that maybe you could get some more help. And so, yeah, listen to your
Certainly don't want to be driving while you're sleepy. So assume that if you're sleepy when you drive, that's an automatic red flag. Do not pass go. Do not collect $200. Go immediately to the nearest sleep center and get evaluated.
amen. Even if you already have, you can have a recheck. I know I see my sleep doctor every year to make sure that I'm still responding to whatever we're doing. So that gives you an opportunity. And if you don't want to wait your year, go in earlier. They can't say no. So, um, Barry, I know you've like salted it throughout the show,
Mhm.
but let's get a quick synopsis on how to get a hold of you. um, I'm assuming I know your book's on Amazon because I found it. It's already in the cart, ready to buy.
Mhm.
So, how else can we get a hold of you? And do you have like referrals to doctors closer to us, or do you do remote stuff?
Sure thing. So I'm at a place where I do more sleep coaching than I do sleep medicine. So the most common people that contact me are somebody who's not happy with their CPAP response and wants a better response, or somebody who's on medications and wants to know what steps and who can they work with to eventually get off medications, where we of course are teaching them about the physiology of what led them to be on these medications. And so those are very, common clients, we call them, not patients. And we see those individuals who have really complex issues, and we don't shy away from it because our the whole career was working with mental health patients who have the worst sleep problems. And so we've learned lots of pearls and tips and techniques and methods to help those individuals. So on my website, barrycrakowmd.com, there's a whole section of some free videos. There's a section of books and videos that you can purchase. Um, there's also, of course, access to my sleep coaching service if you want to register and sign up for appointments. I also have, I should mention, another book is coming out in a month or so called Fast Asleep. And it's a very a short book, and it's about redefining this term sleep hygiene that people hear all the time. And so it's really a guide for advanced sleep hygiene, because I think too many people try sleep hygiene and it fails because it's not really personally tailored for them. And so this new book, Fast Asleep, can help people in that regard. Um, I also have a free Substack newsletter. It's called fastasleep.substack.com. And it has various essays on it. It has some of the podcasts I've been on. It has commentary I make about research that I've been reading recently. So it's another pathway to get more information about my views on what the advances of sleep medicine are, or where sleep medicine needs to be moving, because I've been a pioneer in the field since the 1990s when I first broke into things, learning to do non-drug treatments for PTSD patients with chronic nightmares. And we learned how to treat their nightmares. From there, we learned advanced techniques for insomnia patients who, of course, have very complex sleep disorders. We developed several innovative techniques for those individuals. And then last, with sleep disordered breathing, we developed many of these techniques involving the advanced PAP machines that people use that are far superior to the CPAP. So again, BarryKrakowMD.com is a great place for various resources and to reach me if you want to contact me.
Sounds great. I know we talked about lots of little one things. What's that last one thing you want to encourage our friend to do this week?
Most important thing I can say from this discussion is to really step back, take a deep breath, and ask yourself honestly, is your nasal breathing normal or not? And if it's not normal and you are congested or stuffy or whatever it happens to be, work on making your nasal breathing better. Immediate dividends will come your way.
Sounds great. Thank you so much for joining us today, Barry. It's been my pleasure. Very informative. I love information. So now I get to read the books. Friend, I am not a licensed medical or mental professional. I'm here for entertainment. Thank you for joining and stay tuned for the next episode.
Are you tired of waking up exhausted? You are not alone. If you're looking to take your life back, let's start with the simple step of adjusting your self-talk. Stay tuned for the next episode with your host, Lara Jane. Remember to follow the show so you don't miss the next simple step that you can use to feel more confident. And please leave an honest review.